Welcome. Are you diabetic? Do you care for a diabetic person? These slides are meant for you. I'm going to tackle diabetes based on the patient education. What is diabetes mellitus? Diabetes mellitus means that you have too high blood sugar in your blood. Blood sugar should be absorbed from the blood to the cells. And what causes it? High blood sugar is caused by the following. 1. The body cannot make enough insulin. And what is insulin? Insulin is a vehicle that is used to transport the glucose from the blood to the cell to be used for energy. The second cause is what we call body resistance to insulin. This will inhibit the movement of insulin from the blood to the cells. There are two types of diabetes mellitus. We have the type 1, which is also called juvenile, most common in children. This is normally caused when the pancreas stops making the insulin. We also have type 2 diabetes mellitus, which is caused by lack of enough insulin produced by the pancreas. Note the difference between type 1 and type 2. In type 1, insulin was not produced. But in type 2, we have what we call lack of enough insulin produced by the pancreas. And the second cause of type 2 diabetes mellitus is the cells become insensitive to the insulin. Remember what we said? Insulin is the vehicle that moves glucose or sugar from the blood to the cells. After food is metabolized, the sugar is released in the blood. Now the sugar that is in the blood, or the glucose, is the one that we want to move from the blood to the cells. What is normal blood glucose level? Normal and diabetic blood sugar ranges. For majority of healthy individuals, normal blood sugar is as follows. Should be between 4 to 5.4 millimoles per liter, or 72 to 99 milligrams per deciliter. When fasting is when you have not eaten anything for 8 to 12 hours except water. And up to, if you have eaten 2 hours after eating, it should be below 7.8. That is 140 milligrams per deciliter 2 hours after eating. What about the people with diabetes? For people with diabetes, the blood sugar level target are as follows. Before meals, still, it should range between before meals, it should range between 4 to 7 millimoles per liter for people with type 1 or type 2 diabetes. After meals, for type 1, it should be under 9 millimoles per liter. And remember the 2 hours. And under 8.5 millimoles per liter for type 2 diabetes patients. You can see this is a summary of what we have talked. You can pause and go through it. How will I know if my blood glucose is too low? 1. If you do the test, it will show that it's less than 3.9 millimoles per liter, or 70 milligrams per deciliter. You might feel weak, shaky, sweaty, hungry, irritable or confused, fast heartbeat. But for people who are taking hypertensive drugs like nebivolol, atenolol. Those drugs that end up with, majority of the drugs that end up with all, atenolol, nebivolol, metoprolol. This symptom might be masked because they slow the heart rate. So you might not feel the heartbeat. The other symptom is what we call the nervous. Patient might feel nervous or anxious and might also feel dizzy. What causes low blood sugar or low blood glucose? This can be caused by one, if you skip your meals or you delay taking meals, if you take too much of the diabetic medications, if you take your medication or insulin at the wrong time, or if you have more exercise than usual. What is the best way to raise the blood glucose level? The best way to raise your blood glucose back to normal is one, to eat or drink some form of sugar, such as one, half a banana, a small apple, a small orange, a tablespoon of sugar, honey, or syrup, half cup of juice or regular soda, or you take 5 to 6 pieces of hand candy. Recheck your blood sugar 15 minutes after you have a low blood sugar to see if it is back to normal. Signs for high blood glucose. This means that your blood sugar is high. If you do the blood sugar test, it will be above 11.1 millimoles. If you also do the urine test, there will be high level of glucose in your urine. You might feel tired, weak, thirsty, experience frequent urination, or notice changes in your vision. Causes of high blood glucose. This might be caused by eating too many carbohydrates, not taking your medication, being sick, having a stressful experience. What should you do? Call your doctor or visit the hospital immediately. Important test for diabetic patients. For you to be in control of your blood sugar, you should always know about the foreign test, and you should keep a record and see how your progress is. We have the HbA1c. This can be done either after 3 months or after 6 months. We do it after 3 months if your treatment has been changed, or after 6 months if you have been meeting your treatment goals. This test, it helps us to know the average blood sugar over previous 2 or 3 months, which helps the doctor to know whether your sugar is being controlled. The other test we normally a patient should always be aware of is what we call the blood pressure check. Diabetes makes you likely to have high blood pressure, which can put you at risk for stroke and heart attack. Your blood pressure should be checked every time you see the doctor. The other test is what we call the cholesterol test. The other test is what we call the cholesterol test. This is what we call the bad cholesterol. It's normally known as LDL cholesterol. Because of having diabetes, increases your risk of heart diseases. So it is important to have blood tests to check your cholesterol as part of your annual exam. or frequently if your cholesterol levels are high. Other test is what you call the foot exam. Half of all the people with diabetes will lose feeling of their feet and lower extremities. And according to American Podiatric Medical Association, be sure to complete the foot exam at every hospital visit. That's the recommended. Your doctor will check your reflexes and check your feet for calluses, infection, sores, or loss of feeling. Your primary doctor can do the exam if there is a problem such as ulcers, stime. Foot exam. Half of all the people with diabetes will lose their feeling in their feet and lower extremities. According to the American Podiatric Medical Association, be sure to get a complete foot exam at every office visit. That's recommended by ADA. Your doctor will check your reflexes and check your feet for calluses, infection, sores, and loss of feeling. The other examinational test you need to do is eye exam. Also, this is done yearly. Get yearly eye exam from an ophthalmologist who will direct your eyes to see if the blood sugar has damaged your blood vessels. Why is this important? Checking for early signs of glaucoma, cataract, or what we call diabetes retinopathy. When this is done, this can preserve your vision. Other test is what we call the kidney test. The microalbumin test measures the amount of albumin in protein and urine, compares it to the level of creatinine, a waste product. The ratio of albumin to creatinine. The other test is what we call the kidney test. This will help the doctor to know whether your kidneys are functioning properly. This should be done at least once a year. Dental exams. This is also a vital examination, should be done at least either 6 months or after 1 year. The gums disease is a lesser known complication of diabetes. This can make it harder to control your blood sugar and cause infection and other health problems. So always see your dentist for regular cleaning every 6 months. What is the take home? For all diabetes patients, they should aim that HbA1c level should be below 7%. The blood pressure should be below 130/80 for most people. The LDL cholesterol should be below 100. That is the bad cholesterol. And how can I manage all this? 1, by taking medication at the right time. By having lifestyle changes, eating healthy, doing exercise, maintaining the right body weight. This is what we call the BMI, your body weight versus your height. Stop smoking, lose weight accordingly, avoid alcohol, that every patient should. And most important, always visit your doctor. Thank you. My name is Wilfred.